Hello everyone, it's Dr. Teba and today we will discuss about congenital uterine abnormalities on ultrasound. Congenital uterine abnormalities occur during embryonic life. These are types of Mullerian duct anomalies. These are transabdominal images of the uterus. On the left side is a transverse image of a normal uterus. We can see the normal myometrium and normal endometrial canal. This is the bladder anterior to the uterus. Over here is the uterus tidal phase in which there is a complete duplication of uterus. We see two separate uteri with two separate endometrial canals. There is no connection between them. Also there will be a large frontal cleft which will be present at this location. The frontal left is seen better on 3D ultrasound coronal image. Here we have transvaginal images in transverse plane. This is the normal uterus and this is the uterus tidal phase. We can see two separate uterine and two separate endometrial canals. These are transverse images of the cervix taken transvaginally. Here is the normal cervix and over here we have two separate cervices and as well as because there is incomplete duplication of uterus, so that's why there are two cervix. These are 3D reconstructed coronal images of the uterus. This view is best for diagnosing congenital uterine malformations. This is how a normal uterus looks like in our coronal 3D ultrasound image. And here we have two separate uteri. There is complete duplication of the uterus and cervix. The uterine horns are widely divergent and there is usually a single cervix. The uterine contour is heart-shaped in a bicornuate uterus. It is either heart-shaped or concave-shaped. There is concave-shaped indentation here. This is a 3D coronal view of a bicornuate uterus. We can clearly see a heart-shaped uterine contour. The frontal cleft has a depth greater than 1 cm. The uterine horns are widely divergent. The angle between the uterine horns will be an obtuse angle. It will be greater than 105 degrees. Both uterine horns are connected to a single cervix. A unicornoid uterus will have only one uterine horn connected to only a single fallopian tube. It is difficult to see it on 2D ultrasound. We may use tilting of the uterus to one side in the pelvis. A unicorn weight uterus has a banana shape. Unicornoid uterus is seen very well in a 3D coronal image. Only a single uterine horn is found. We can see the banana-shaped uterus tilted to one side. Now septate uterus, the endometrial strip is separated by septum at the fundus. This is the septum in transverse view. You can see that it has divided the endometrial strip. This septum is isoequivalent to the myometrium. Here is another transverse image of the septate uterus. An isoequivalent septum is seen separating the endometrium. Here we can see a septate uterus in coronal view. We can see a thick isoequivalent septum in the middle of the uterine cavity. Here will be an acute angle formed as a fundal indentation right here, and the depth of this indentation will be greater than 1.5 centimeters. The uterine fundal contour is convex shaped here. It can be flat Uterus is the least serious type of congenital uterine abnormality. The transverse diameter of the uterine cavity is increased and a small indentation is separate at the fundus. It measures less than 1 centimeter. An obtuse angle is formed at the fundal indentation right here, and our greater uterus is actually considered a normal variant of uterus and has very less association with reproductive failure.